According to the International Diabetes Federation, diabetes is now a disease that affects 371 million people worldwide, and 187 million of them do not even know they have the diabetes. Researchers estimate that the diabetes dilemma will only increase. By 2030, they expect 552 million people will have the diabetes. Let's talk to the expert what diabetes is and how we can secure ourselves with diabetes.
Overweight in itself is a big problem in our country, and unfortunately it's on the rise on these days. There are several contributing factors towards it. There is a less amount of physical activity, there is more amount of stress, there is more amount of contribution toward the diet that we eat today. So yes, overweight is increasing in our country, and there's a good amount of data which today suggests that overweight increases or else plays a role as a risk factor for diabetes. Physical activity affects diabetes a lot, because when we talk about physical activity, the amount of physical activity which was done earlier has decreased a lot. There are several reasons for it. One is that we have everything available today at our doorstep. Secondly, we usually don't want to use public transport. We are more comfortable with our own cars. And the third and the most important thing is the time management. So because of which, and because of several other reasons, physical activity has decreased a lot. And yes, physical activity plays a big role when it comes to diabetes as a risk factor. So the diabetes symptoms are polyphagia, polydipsia, that is increased thirst, frequent urination, polyuria, early tiredness. These are all the early symptoms of diabetes. When it comes to dietary things for diabetes, one thing is very, very important is that we should try and look forward that we control our diet in terms of the total calorie intake. We control our diet in terms of the complex carbohydrate. We include more of complex carbohydrate, and we decrease simple carbohydrate. We take more of fiber-rich diet and increase our fluid intake. Yes, diabetes to some extent might increase the risk factors for the other medical problems. It does have an impact on cardiovascular diseases, microvascular complications for diabetes like retinopathy, nephropathy and neuropathy. See, how often you check your blood glucose level is a question wherein depends upon which risk factor group you belong to. If in case you belong to a high risk group, you need to check your blood glucose level more frequently as compared to a group which belongs to a moderate risk or a lower risk. If you want to prevent your diabetes at an early stage, see, depend upon whether you are diabetic or a pre-diabetic. If you are pre-diabetic, you certainly don't need any medication. You need to focus upon lifestyle change and the dietary change. When it comes to lifestyle change, you need to increase your physical activity, especially morning walk. When it comes to a dietary change, you need to look forward that you have more of fiber-rich diet, you take more of fluids, and also you decrease on the simple carbohydrate in your diet and increase more of complex carbohydrate. Yes, genetic predisposition is a very, very critical and important role in diabetes, and type 2 diabetes is majorly dependent upon the genetic predisposition. Smoking in itself is obviously bad for health. Diabetic person already has several risk factors like cardiovascular risk, stroke and all other things, and I would think, and I certainly believe that you would not like to add upon any extra risk factor like smoking into your diabetes part. If a person has a good lifestyle, he is physically active most of the time and he takes care of his diet pretty well, if in case he doesn't have the genetic predisposition, he's at a lower risk for developing diabetes. There's a good amount of research which is available today which says that people who are diabetic are comparatively higher risk factor for a stroke and heart attack. In life, for doing anything good, it's never too late. It's better to start now. In order to prevent diabetes, a person should focus upon increasing his physical activity, One. Second is focus upon the stress management. He should try and see what he can do, meditation and all other things for the stress management, and work on the dietary management. As I mentioned earlier, also increase fiber in the diet, increase fluid intake, and take more of complex carbohydrate and avoid simple carbohydrates. For a diabetic patient, it's a comprehensive management. For a diabetic patient, it's more of medication plus lifestyle management plus dietary management. You cannot choose either of them. They have to work together to give you the desired results. I would say people who are diabetic should focus upon three things: increase physical activity, do a good diet control, and also do a good stress management.